I'm talking on behalf of DermaVidya, Access to Dermatology World. Today we are discussing skincare tips during acne. We all know acne is one of the most common conditions generally seen in teenagers but also can be seen in adults. It is a disease of the pilosebaceous unit, which means your hair follicle and the oil producing gland. There is an inflammatory process going on in them, in simple terms. Acne is a multifactorial disorder. That means a lot of factors contribute to acne. Some of them can be your genetics, diet and lifestyle, stress, and of course your hormones. Let's talk about skincare tips while you're undergoing acne. I want to divide them roughly into two categories, some do's when you're facing acne and some don'ts. Let's talk about the do's first. Number one is cleansing. Of course, it's very important that you cleanse your face, not because acne, if you have acne, it means that your skin is dirty, but because most people facing acne have a little oilier skin. So it's important that you get rid of all the excess sebum production, and preferably twice a day if you use a cleanser, it's really beneficial. Any more than twice a day is going to strip your skin off of its natural oils and can in fact lead your skin to produce more oil, in turn making your acne worse. So stick to washing your face twice a day. When it comes to products, choose something that has salicylic acid or benzoyl peroxide in it. And another important tip when it comes to cleansing is, when you're washing your face, wet your face first, apply the cleanser, leave it on for at least a minute and then wash it off. Most of us have the habit of just applying the cleanser and washing it off immediately. That's not going to do anything for your skin. But however, if you leave it on for about half a minute to a minute, it has some time to go deep in your pores and cleanse that excess sebum production, and it's going to help you much more if you do it that way. Number two, moisturizing. Now you may feel that because you have acne, there is no need to apply moisturizer, but it's one of the biggest myths out there. You still need to put moisturizer even if you have acne, because some of the products that we'll be using, like your cleanser or any other active ingredients that you're using to treat your acne, are going to be drying your skin. So it's important that you restore that lost moisture with a moisturizer. Now, if you're living in a really humid place, like for example Mumbai, it's not necessary that you use a moisturizer, as opposed to a place like Bangalore where it can be a little dry. In that case, you have to use a moisturizer. Number three is protecting. When it comes to protecting your skin, especially when you have acne-prone skin, I cannot emphasize on sunscreen application enough. Now, a lot of people think that because they have acne, they don't want to put sunscreen because most sunscreens make their skin oily, sticky. But there are a lot of brands now who have come up with really good sunscreens that are gel-based or silicone-based, which are really easy to apply on acne-prone skin. So I would really encourage you to apply sunscreen, and if you're outdoors, I would encourage you to reapply it every 2 to 3 hours. Why? Because when you have acne, there is an inflammatory process that is going on in your skin, and when you expose yourself to sun, especially direct exposure for longer durations, you're going to cause something what we call in medical terms post-inflammatory hyperpigmentation, or as you would know, acne marks. And the marks that will come because of the sun exposure take really long time to disappear. It can take up to a few months to a couple of years for some of the marks to disappear. So the best way to treat the acne marks is to wear sunscreen and prevent the marks from happening. Number four is treating. Now, of course, I'm going to encourage all of you to go see your dermatologist and not treat your acne at home. But in case you're not able to see your dermatologist, you're traveling, or you're in an emergency situation where it's difficult for you to go meet your dermatologist, what you can do is use a hydrocolloid containing acne patch for your individual acne. That is going to remove all the pus and the gunk out of your acne and prevent it from becoming worse. Other than that, the best treatment for acne are retinoids. So see your dermatologist and get a prescription for a topical retinoid. Don't try to start retinoids on your own, because when you don't know how to apply them, it can cause more harm than good. Now let's talk about the don'ts of skincare when it comes to acne. Number one, and the most important one, is saying no to physical scrubs. Physical scrubs may seem very exciting because you may feel that it's going to renew your skin, but it's not the case. Because of the small particles that are available in the scrubs, you can actually literally abrade the skin, causing small cuts in your skin. You're going to damage your skin barrier, which is already compromised because of your acne, and you're going to alter the pH of your skin, leading to problems you weren't dealing with before. If you really are considering exfoliation, go for chemical exfoliations with some alpha hydroxy acids like glycolic acid, mandelic acid, which will do the same job without causing the unnecessary effects that come from physical scrubs. Number two is not popping, squeezing, or scratching your pimple. I know it can be very tempting, especially when you have an event coming up and you want to get rid of that red, ugly looking pimple. But believe me when I say you're going to make the situation way worse if you try to pop it. Because our hands are filled with germs that you cannot see, and when you try to squeeze or pop a pimple which is filled with pus especially, you're going to worsen the infection and the inflammatory process there, and it may take longer for the acne to resolve, and it can also lead to some scarring. So steer clear from absolutely just not touching your skin. Just best is to not touch your skin at all, and you're going to be good. Number three is rubbing your face really harsh. I already spoke about the physical scrubs, but a lot of people have the habit of rubbing their face really harshly while washing their faces. That also can lead to a lot of side effects, like altering the pH of your skin, making your skin really sensitive to some products. So stay away from rubbing your skin harshly. Use your fingers to wash your face and be really gentle. Number four is overdoing your chemical exfoliating agents. I know I just mentioned the benefits of chemical exfoliation over physical exfoliation, but that doesn't mean you go ahead and use your alpha hydroxy acids like glycolic acid and mandelic acid every other day. Stick to using them once or twice a week at the max, and you're not going to cause any harm to your skin. As a dermatologist, my advice to you all is to not self-medicate for any hair and skin related issues, and please see a dermatologist near you before starting any treatment. I hope I've been able to give you an overview of skincare tips during acne. If you like the video, make sure to check out the website DermaVidya.com for more such videos.
For more such videos, visit or log into DermaVidya.com.